Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast.
This is KSJE, community-supported public radio from San Juan College. KSJE has been sharing, celebrating, and promoting the art and artists of the Four Corners for more than 35 years. Connect with KSJE on air, on demand with KSJE podcasts, or with the KSJE app. KSJE, the information and cultural beacon of the Four Corners for more than 35 years. Find out more online at ksje.com.
Eleven minutes past 8 o'clock. It is Wednesday morning, the 12th day of November, 2025. Good morning, everybody. I'm Scott Michlin. Thanks for tuning in to KSJE, 90.9 FM over the air right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on the planet, you've gone to our website to do that, streaming all the time from ksje.com, or perhaps you're listening to us through the new KSJE app. It's great to have you all with us this morning. Also, welcome to our viewers who are joining us today. The video of this program streaming out live to the KSJE Facebook page and also to our YouTube channel. It's great to have you all with us as well this morning, because coming up, our conversation about healthcare with my guest from San Juan Regional Medical Center. We're talking about healthcare privacy and fraud and some of the other concerns that folks are working very hard to avoid at the hospital. We'll tell you how that works in just a moment here on KSJE, so stay tuned for that. Next hour, of course, classical music with Mick Hess, our Roving with the Arts program coming your way at 9:06. That will take us to 10:30, and right on Four Corners, our local and regional author program. Our host, Delcherie Gladden, is talking with Kate Niles, a New Mexico author, about her latest book called The Last Hanging. That is coming up today at 10:30 on KSJE. Also, remember, you can connect with us on other forms of social media like Instagram and Blue Sky and X. And if you're a podcast listener, you can subscribe for free to KSJE Podcast. You'll find them where you're already listening to podcasts, so check it out and discover a new local program that you may have missed. Or even better yet, stay connected through the new KSJE Radio app. Podcasts are right there. Listen live and much, much more. It's available now at the App Store and on Google Play. Outside our studios this morning at San Juan College, it is a partly sunny Wednesday morning, 31 degrees at the moment, and we are expecting a partly sunny day today with a high of 62 degrees in Farmington. 41 overnight tonight. It'll be partly sunny again tomorrow, Friday, Saturday, Sunday, it looks like, with highs of 65 tomorrow and Friday. Overnight lows near 40, maybe a little cooler on Saturday with a high of 63, and then much cooler with maybe a chance of some rain showers on Sunday with the high only reaching 56. I'll be back with my guests from San Juan Regional Medical Center right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
Back in the studio this morning, and joining me here from San Juan Regional Medical Center, as I mentioned, joining us back for a return visit, Scarlett Denman is here this morning. Good morning. You're the Director of Health Information Management at San Juan Regional Medical Center. Good to have you back with us.
Thank you.
Thanks for being here. Also joining us here in the studio as well, the Interim Compliance Officer, Ricky Callister, is here this morning. Good morning to you.
Yeah, good morning. Thanks for having us.
You bet. Good to have both of you here this morning to talk a bit about healthcare privacy and fraud and compliance and other issues at the hospital. This is what you all are doing each and every day in your various areas where you work. And so we were talking before we came on the air this morning about this area, and I was learning a lot from our conversations. And so it'll be great to share with our audiences a little bit about the work that you do and how much goes on behind the scenes. And so, Scarlett Denman, I want to start with you a little bit about this issue of healthcare privacy and just how important it is. We know about, I think everyone knows about HIPAA, and this is all kind of under that to a certain amount, but then there's more to it than just some of the HIPAA laws that we're familiar with, correct?
That is correct.
Talk to me about more of that then. What falls into that?
So what falls into it is protecting that patient's legal medical record, being compliant with our payers, the insurance companies, and watching for fraudulent activity, whether it's within the hospital or our patients. You know, if they have an issue that with their record, they can come to either one of us and our departments for that. But just overall making sure patients are aware of their privacy and their confidentiality and their compliance for their record and making sure it's accurate.
Mm-hmm. True. And I guess if someone finds something in their record that's not accurate, there are steps that they can take with your help to correct that?
That is correct. There is a request under the HIPAA laws that are governed by the Office of Civil Rights. Mm-hmm. They have the right to be able to do what's called a request to amend. We have under HIPAA laws, we have 60 days to act upon that. We can ask for a 30-day extension, but oftentimes we don't even have to. But what happens is patient says, I was reading in my portal or on my records when I got copies, and I found this was not accurate. And so they can fill that out. I have to have it in written format, identifying who they are, what the issue is, where they feel they found it, and then that's turned into me. I do the investigations and everything, along with Ricky. At times I have to reach out to an informatics person, a clinical, or myself to the provider. And then Ricky and I work together to send that notice back to the patient, whether it's approved or denied. Sometimes we look at it and we're like, everything, it is accurate. Mm-hmm. You know, sometimes patients may not want to hear that, but we show them the accuracy behind that. And then we notify them. Majority of the time they are approved.
Right.
Sometimes it could be a misdictation or a misinterpretation that what the provider or nurse heard the patient state.
Yeah, got it. And so it's pretty easy to correct, I guess, something of that regard,
it is.
Right?
We amend the actual document in question, and that way it has a new date and time stamp and what the correction is.
Got it.
And then we always mail a letter back out to the patient out of our compliance office, and along with whatever the corrected information is.
Sure. And I guess that paper trail is also very important, too, to be able
Absolutely.
to show what you did, when you were notified, when you corrected it, and things like that. And I guess, Ricky, for you, Ricky Callister, for you, when you're looking at compliance and things like that, to make sure that that's done within that 60 days, or if not, an extension's been asked for, or everything's on the up and up kind of thing?
Yeah, exactly. And so there is a process, like Scarlett was saying, and it's not to make people fill out extra forms, but it is to have some of that structure so that we can internally look at that and make sure, like you said, that we are tracking that and completing that in a timely manner.
Sure. And it works for the patient, too, I guess, to have that record as well, right? So they can look at that as well. I wanted to also point out that we were talking again before we came on the air this morning about just, the amount of maybe spam emails that we personally get in our email accounts. And that's, I guess, tenfold higher at the hospital. People are always, I guess, maybe sending you all emails that maybe are disguised as a bill or a request for information or things like that, or faxes even that you get that we were talking about that maybe looks like it's coming from an insurance company, but it's really not, or things like that. This is also part of this fraud and potential scams that you always need to be alert for.
That is correct. Because if we get something, I know my team has, Ricky's has, around the hospital, get something, it looks legitimate. It truly looks like a real fax. It's from a real payer or a real company, but just something's off. A lot of times you can read it, and as you get into reading it, you see it's not, English is not the first language by whoever the fraudulent writer of that is, or hacker potential. So you look at those little things with English and grammar and things, and it tells a story.
Yeah.
And so then we either do not respond, or, we ignore it, we report it. We always report everything to compliance. We encourage all of our employees to do that around the organization.
Yeah. Sure. And the idea that they are fishing for something or looking for something, they're trying to glean, and we were talking about this too, which I thought was interesting, that not necessarily like when I get, credit card numbers or whatever, we need you to confirm your whatever, but they're even looking for just maybe health information or personally identifiable information. And then with that could lead to a possible identity theft situation or other things, which has a value, I guess, on this dark web, which these people, I guess, deal with. And
Yes.
that's why you guys are a target, I suppose.
Correct, because what happens is a patient will come in, and we all need to watch our credit cards on the gasoline skimmers, or when we give our credit card to pay for something. We all need to still do that. But on the black market, your credit card information is worth like $1. Used to be much higher.
Yeah.
But your medical record on the black market is worth almost $100 now. When I started teaching on this, it was back when it was $50, $60. We've seen that over the years just increase. Now it's about $100. Because you go, well, why? Why does somebody want my medical record? Well, because I can get free health care. I can go in and say, I'm Scarlett Denman, but I'm really not. I might look similar, but I
look
have
at this
the
great
Social Security
insurance
number.
that Scarlett has that now
Right.
I can get.
Exactly. And they can get free health care, they can get free drugs, and they can steal my identity with it as well. So it's very much monitored, watched. We're very cautious about it. We validate, if it means calling back to make sure they don't answer Joe's Pool Hall, and they're actually as saying, oh, this is Blue Cross Blue Shield or Humana or whatever.
Right.
So,
Interesting. And that happens all the time. I mean,
all the time. We're
it's-
always on guard
Yeah.
with it,
Amazing.
protecting the patient information.
Sure, exactly. And Ricky, again, in your world, again, this is something that you deal with as well, or is Scarlett the first line of defense when these things happen?
I'd say everyone is kind of the first line of defense. We've done a lot of education and training, not just with our individual departments, but
Right.
with the staff as a whole, because sometimes it's going to pop up at a family medicine clinic. They're getting faxes, or, we have a couple dozen clinics and the hospital, and there are lots of fax machines and lots of phones that people try to call us and try to steal patient information. And so really, I would say it's throughout the whole organization. And sometimes they're looking for patient information. Sometimes they're looking for physician information. They're trying to get their social security information, their signatures, because then these scammers, once they get that information, like you said, the goal is the money. And so once they have that information, then they can create fraudulent bills. They can run some fraud schemes with that information, using the physician's information to pretend like that physician ordered something. And so it really is important. We certainly try to do our best to catch those, and we're doing a really good job with that. But then sometimes those phone calls go out to patients.
Right.
And that's where we want everyone to be aware that it's not just the hospital, it's everyone that can receive these types of scam calls.
Sure. Interesting. And we were talking, too, a little bit before we started on the air this morning about maybe someone sharing something on social media, the thing we all love to hate. Yes. It is part of our lives, but sometimes we can overshare, and that happens sometimes, too, with folks maybe just making an innocent post about, hey, I'm going to the doctor to try to get you mentioned maybe your back looked at or whatever, right?
You look up and you say, hey, I need to go, my back's been hurting. So they'll look it up, they'll make an appointment with the facility, like say with us,
right,
and our spine clinic, say. But at the same time, they post on social media and say, oh, I had a 10 o'clock appointment this morning at San Juan for this, my back's been hurting me. So they've given a location, they've given what the problem is. Then what happens is I encourage everybody, like everybody in my family, I'm like, do not put your phone number or address or anything like that on social media. Because then the patient, the true bad person, the hacker comes, oh, Mrs. Jones, how you doing? I know you were seen this week for your back. Are you better? How's it going? And then we have a potential for a breach at that point, because now somebody has identified, because in the patient's mind, oh, they must be calling from a legitimate place to help me.
Right.
When in actuality, it's not.
Right.
It's for them to be bad actors, as we call them.
Exactly. And there's so much now that can be done to look like it's a local call, to look like it's coming from the clinic, to look like all these things from the phone number, right? And to make it sound legit. Maybe they have an accent, maybe they don't. Who knows?
Right.
But it's really important for folks to be on guard about that. And even an innocent post like that can lead to something if we're not careful. And so I guess the alert falls to the patients too, I guess, right? To be aware after
for them to be good responders to, because most of the time, like, unfortunately, I was one that they did it to a few years ago, and my chief operating officer was standing next to me when I got the call on my cell phone. And she's like, oh, this is going to be fun, because I just kept pushing back and pushing back. And that's what we encourage people to do, is question. Why are you calling me? What are you needing? And if they keep pushing back, because usually if you give enough pushback, all of a sudden the phone goes dead and they hang up on you. They may try back, and what we find is a lot of times with these bad actors, it'll start out with like a male voice. When you start giving pushback, the call goes dead. Then a few minutes later, a female voice comes in to try to continue if they really want to keep targeting you.
Right.
Sometimes they just give up.
Sure.
Sometimes they don't.
Right. Well, it's all about the numbers, I suppose, too, right?
Exactly.
And so, again, if they get maybe 2 out of 10, they've made their quota or whatever they have for the day and things like that. So it's really interesting. And so this happens time and time again. It happens with the hospital. It happens with different, I guess, departments at the hospital. Are all departments maybe potentially a target for these folks?
Yeah, I would say all departments are a target, and sometimes they're going to target people who may have had a recent visit, or kind of like Scarlett was mentioning with the social media posts and that kind of information. But sometimes it's even out of the blue. There's not necessarily anything other than they know your name and they know the area that you live in. And most of that, like Scarlett said, now is just on the internet, whether we like it or not.
Right.
And so then they know where to target and how to talk. And it's any department in our organization at any given time could receive a call or a fax, and certainly emails, like was mentioned. And we have a great information security team that's really been working to really get some more safeguards in place than we already had, to try to prevent that type of try to prevent those emails from coming. And then if they do come, our IT team does lots of training to all of us as staff to make sure, like you're saying, don't click on emails that you don't recognize, right? Don't click on links to those or attachments in those emails.
Right. All the things we hear about, which is still really important for everyone. We do it here at the college. And again, I know IT departments everywhere have all these filters in place to try to keep these things from hitting our inboxes. But every once in a while, something will sneak through. And so, again, that end user still has to be vigilant to be looking for those things. And that includes the folks at the hospital. Pardon me?
Awareness.
Awareness is right, again. And this is, again, from the medical floors to the offices to administration and everybody else. Are these all these folks get targeted for some of these scams and some of these things?
Even all the way to our CEO. Sometimes our IT department will go, please be aware, we're getting text messages or emails, and they're portraying like our CEO, Jason Rounds. And so, of course, everybody wants to answer that text.
Imitating him, like it's coming from him.
Right.
You certainly don't want to ignore an email or message from the CEO.
Exactly.
Yeah.
And that's why they do it, because they know staff are going to, oh, it's Jason, I need to answer. No, you need to be vigilant.
Yeah.
To make sure it really is that person.
Right. Exactly. Interesting. And so, again, this is happening, and you've got systems in place to help protect your patients, your employees, your staff, and things like that. I'm just wondering off the top of my head, just sitting here talking to both of you about electronic health records. Has that been better to kind of secure those things than they used to be when they were just paper and running around and things like that? Is that, what do you think, Scarlett? You're looking at me like she's thinking the wheels are turning.
I saw Ricky looking, I'm like, he's going to let me do this.
The wheels are turning.
It is
Mixed
easier
bag?
in ways, but not. It's that we have to be better. We have to be more vigilant. That's why we have a lot of softwares and tools from our IT teams and compliance for us to be aware. It's why we teach. We teach it from orientation to learning all throughout the year to going around doing HIPAA rounds. We do that every month. for awareness and making sure, because patients are reading their records more now with portals since 2010, 2009, but they're reading them more. Plus, you have more access to your records. But there's also a lot of those bad actors out there trying to get that information. So we're more vigilant because we've had to put more tools in place to protect the electronic. Because if you read any newspaper or radio or anything, you hear daily about large companies, large hospitals being hacked or shut down because there's ransomware, to it. It's happened to us, and we recovered from it a number of years back. But it's happening every day to all kinds of facilities, and we've got to protect that information.
Sure. Right. And I guess when something is electronic, it certainly can be more secure and more protected. But then, as we've seen, even at any workplace, somebody hits a reply all, and now that record that was only supposed to go to one doctor has gone to all of them. Or something, which is, I know it makes you probably break into a cold sweat when we talk about things like that.
It does.
So, but it's just as easy as that. And so that's what you all are vigilant about, and that's an important thing too. Ricky Callister, I want to ask you too a little bit more about your job and compliance and things like that. Do you work with a lot of, federal agencies and things like that when you're dealing with bookkeeping and record keeping and things like that to make sure the hospital is compliant with all these different rules and regulations? I'm sure some that we wouldn't even know about.
Yeah. That's a big part of what we do in our department is having that connection with some of those federal agencies. If there's a concern of some kind of fraud occurring at our organization, they're the ones that they reach out to us. The Health and Human Services, their Office of Inspector General is often who we coordinate with, and sometimes the state, New Mexico Healthcare Authority.
Right.
And so we work with them. We work with a number of individuals, and so sometimes it's from within our organization, and sometimes it's people that we may be doing business with.
Right. I was going to say it's probably got to be almost all levels, right? Even tribal, I suppose, too, right? If you have interactions with the tribal government, there's also part of that to follow up with.
Yeah, exactly. And so sometimes it is the internal bills and things like that we're doing, making sure that all of our finances are done honestly and ethically. But then it's how we interact with, how we interact with some of the other providers in the area.
Right. And those governmental agencies, I guess, that are managing those funds that come to you.
Yep. They manage those funds, and Medicare, Medicaid dollars are taxpayer dollars. And so we want to make sure that we're being good stewards of those resources. And so we interact with them a lot, and we work with them to, if there's a problem on our end, something that we did wrong, then we correct that and get it addressed. And if there's someone else that we have some concerns about, then we work with them to give them some information, again, like you said, to try to protect those funds and make sure that they're used appropriately.
Sure. Right. Got it. Very interesting. And so, again, it's really important that everyone realizes, I guess, just how much is going on behind the scenes. Because for a lot of patients and a lot of folks who come to the hospital or to your clinics and they're getting services each and every day, they may never realize that behind the scenes, you all are running around making sure that the bills going out are legit and the payments coming in are legit and they're being credited properly to their bill, whether it's an insurance payment or something else, or a copay or whatever the case may be. All that is happening kind of behind the scenes and happens thousands of times a day, I would think.
Yeah, happens a lot.
From the size of the organization, right?
Yeah, absolutely. So
it's a well-oiled machine, it sounds like to me, and that's important to keep it that way, and that's why you're here, right? To let folks know. What other things that should folks be know about? I guess about the work that you all do when it comes to whether it's their family doctor or what have you, or going into the clinic, or maybe they're not part of San Juan Regional, but certainly there's a relationship there between their doctor and the hospital.
Correct.
How does that
So, like,
work?
if patients say is coming to us, say from Gallup area, because we have a lot of patients, because we're in the Four Corners, and we are the biggest game in town in this whole region. And so what happens is a patient comes to us, and they may come to us with records from another place that are sent either hand carried, electronically sent to us. We build it into our record. And back to that request to amend, we may, when I'm doing an investigation, I may see, well, we only pulled that information in from your provider you had in Gallup. So then I have to advise that patient to go back to whoever was the authenticator of the documents for them to fix it and then make sure we get a copy of it. But further than that, it is literally our biggest is protecting that patient information, making patients aware. Make sure when you're leaving your office, you know, from a clinic, whether it's from our ED or an inpatient visit or a clinic visit, that you're literally looking at that information, making sure it's you, making sure it's your name, your date of birth, your address. Because people are printing things. You have two people checking you out, and they print and they grab something off the printer. We teach our staff, make sure you look at it. One thing is they should highlight the name. It just draws their brain to look at and say, yep, Sally Jones, I'm going to give this to this patient. They get home, they may see, wait a minute, this is Tom Smith, you know, or another person, John Doe, and then they notify us. We have to investigate that. We look at it from compliance and privacy. We look and say, how long were they in possession of it? Did they have long enough time to do something bad with it, or ill intent, I should say? And
even if the person is innocent and they just got it the wrong paper,
the wrong
and they
paperwork,
right.
right.
And they don't want it, they never wanted it, but you have to investigate.
We still have to investigate it. And we look at that very serious to see all of that. There are times, recently we've had to call another patient, the patient who was, say, we need to make you aware, this happened, and we've already shredded that, or we've asked the person to shred it, which majority of people do.
Sure.
Most people do go into it with the intent to do good, not bad. And so we have to look at that. There's other times if maybe somebody, years ago, I had somebody 2 years later, they come back and say, oh, I had it on my coffee table and I didn't clean it off. I'm like, man, there's nothing I can do 2 years later, you know, because it's been too much time has lapsed.
Right.
But at the same time, if we do have a breach of information annually, San Juan Regional is required, just like any healthcare facility is required, to report that to the Office of Civil Rights. How many breaches did we have? What was the intent of the breaches? How many people were affected? What did you do about it so it doesn't happen again? A lot of times it's education, teaching, working with IT or something.
Right.
But oftentimes it is basically education.
Sure. And it sounds like to me maybe there are different levels of breach that you have that you are reporting to. Maybe something is just like we handed it out, they had it for 5 minutes and gave it back to us before they left the office, and that's still a breach, but it's not maybe like it's sitting at their house on the coffee table for 2 years.
Right.
There's different levels of
If
seriousness.
say it was
maybe
we sent the wrong prescription to Walgreens Pharmacy and we realized it. That's a breach on the wrong patient, but it's called a covered entity. Covered entity to covered entity under HIPAA. So yes, it's a breach. It's not a reportable breach.
Got it.
Versus we faxed it to the wrong number, or we electronically sent it somewhere, or gave it to the wrong person, and then that's then a reportable breach. Like when we hear on the news, hey, you know, this insurance company had a 200,000 patient breach. Anything over 500 patients, you have to report that to the media and other places. Under 500 is different. We report it to us, we report it to OCR, and go about our business that way.
Right. And I guess the people that are involved too, you would have to notify them, as you
Correct.
said. And that's
Yes.
all part of it. And then I guess that comes to you, Ricky, as well, to make sure it gets reported properly and everyone who's supposed to be notified is notified and things like that, just to make sure all the I's are dotted and T's are crossed in an investigation like this?
Yeah, exactly. We have a team that helps get all that together and get that out, and we make sure that it's done timely.
Mm-hmm.
Right. And again, I'm not wanting to leave the impression that this happens on a regular basis. Yeah. It's a pretty rare occurrence, I think, at many medical facilities because of all the training and all the work that you all are doing behind the scenes to avoid things like this happening. But when it does, there are certain rules and procedures that go into place automatically, I suppose, right?
That is correct.
And so that's an important thing, too. So just a couple of minutes remaining this morning for the both of you, and to remind everyone then just about their medical information, medical records, that you are protecting them at the hospital, but they also have a responsibility to protect their medical information personally as well, I guess, right? Because
Correct.
of this, I guess, just how valuable that information can be to folks that would want to do bad things with it.
Yeah.
That is accurate.
Interesting. And so, and again, it has a value. We may not think about it, but again, on the dark web or wherever they're trading this information or selling this information, that's what makes it so valuable. And having it in greater numbers, I guess, is why these people are so coming after it so often.
Correct.
So
Yeah, so we want to hear from patients if they have any questions about it.
Right.
If they have concerns about someone reaching out to them or how it's being done, they should just reach out to the organization directly. Reach out to their clinic directly. Reach out to the organization. If it's a bill, their bill has contact information on it. They should follow that number rather than any text they get or any suspicious way that they're being contacted. They should just reach out directly.
Yeah, that's always an important thing as well. And again, if there's something wrong in the medical record, they need to go back to that original provider or whomever it was that created that document to get it fixed, I guess. Even if it gets forwarded to the hospital, you may be limited as to what you can do with a document that you didn't create yourselves.
Correct.
And so that's another important part of this. So very good. Well, thank you both for coming in this morning. I really appreciate it. As I said, it was a very interesting conversation. I learned a lot. I hope our audiences did as well about protecting our medical information and the work that you all do to protect it at your end too. So thank you.
Thank you for having us.
You.
You're welcome. Thank you very much, both of you. My guests this morning from San Juan Regional Medical Center with me here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.